It is 7:18 here on Breakfast Television. We've all heard the nightmare stories about long-term care centers, long-term care facilities, from the military reporting on them as they were helping to work there. We've seen the numbers. Our elderly are the ones bearing the brunt of this pandemic. Someone who's been following this story for months now is our own Cynthia Mulligan, our political reporter from City News. Cyn, thank you very much for joining us this morning. A difficult day for you yesterday.
Well, it's tough. I mean, it's tough reading these reports from the military. I mean, that was gut-wrenching if you read the entire 23 pages. And I get a lot of emails and DMs from people telling me the stories about their loved ones in long-term care. And it's really, really devastating. One woman that I talked to yesterday, her name is Cindy, and her mother is legally blind. She's on the 5th floor of a Scarborough long-term care home, and she hasn't been able to leave her room for 2 months. And imagine, her family would come every day to visit her, 7 days a week, and she's had nothing. And she's gone from being very sharp, very social, she liked to go down to the dining hall and talk to people and laugh, to barely gets out of bed and answers questions with one word. And her family says the social isolation is more dangerous than COVID. And those are things that we really have to start talking about.
Well, and yesterday, the long-term minister, I believe, did say there, or the medical officer of health? I'm trying to remember now. It went out of my head.
It was Dr.
Talked about they're going to start looking at this because they need to start opening up to let people see them, because the long-term impact of this could be devastating for so many people.
Absolutely. So Alberta and Quebec have eased restrictions, and Quebec that has had, an even bigger issue than we have here. But what they're doing are socially distant visits. So in Alberta, for example, one person can go and stand apart from the resident. Now, I know that's not easy, because you have to remember a lot of these patients have health issues, have dementia issues, but still, we've got to be creative and find a way. And at the same time, I totally understand when the Associate Medical Officer of Health says this is a balancing act. We've got to be careful because we don't want to reintroduce it into these homes. But we have roughly 200 that are in outbreak out of the 600 plus. So I think with the warmer weather, there must be something that we can start doing for these people.
And are we starting to see, the numbers now we've seen, most of them are community now. It's not in the nursing homes. Are we starting to see it under control in the nursing homes that are affected?
The medical officer of health, Dr. Williams, said the other day that he's starting to feel like it's getting more contained. So yes, but we've seen firsthand it spreads like wildfire, as the Premier has said. So they're being super cautious, and I don't blame them. I mean, we certainly don't want to lose any more lives, but at the same time, the damage to their mental health is quite staggering and very concerning, and can be just as dangerous at this point.
And I can only imagine, because we're all feeling it. We're working from home. We've reduced our contact with so many people, and that's devastating. And to have virtually no contact with your loved ones, and especially at that time in your life, I can only begin to imagine. Let's talk a little bit more about the report from the military and the province's response. One of the things I found interesting was when I believe you asked them when the last report was, and they didn't know. Or when they had last gone in to look in those different homes there, and they didn't have a date or a time on when they'd gone to inspect them.
So that actually was not my question. That was Laura Stone from the Globe and Mail. I can't take credit for it. But she asked the Minister of Long-Term Care what you said. And what I'm finding interesting is, listen, this is a disaster for the government, because one of the key questions is, why did the military have to expose this? Why wasn't it discovered first by government inspectors? And the government has faced a lot of criticism for changing its inspection process. A lot of people said they cut down on the inspections, that their last budget made cuts to long-term care. So it's a very valid question. Why was it the military who discovered this? So the minister and the Premier are facing some very difficult, challenging questions on this, very uncomfortable questions. And when the minister was asked point blank, when was the last time there was an inspection, she deflected and went in a different direction and never answered the question. And what she continually was saying yesterday was inspections weren't the problem here, because the situation evolved so quickly. It's lack of staffing. And they keep referring to the fact that this is a decades old problem, long-term care. And they are right. However, there are some things that they really have to answer to. So Doug Ford has expedited the commission examining the long-term care issue. It will start in July, not September. That's great. He's promising that it will be fully transparent. He even said that he would testify if he's asked to be a witness in it. So that will be very interesting. And there's going to be some really ugly truths that come out of it.
Absolutely. I mean, this government's been in power now for 2 years. You can blame previous governments, but eventually you have to take ownership on what's happening. And I know this is extenuating circumstances,
yes,
but still not easy.
But we in the public also have to, really take account of this. And listen, there have been multiple stories. City News has done many stories about long-term care, all the other media outlets as well. This is no secret, but it's been a secret that nobody's really wanted to look at very hard. The public has turned its eyes, and they have not demanded that politicians do something about this, not the public at large, unless you have a family member in there. So I think now it's impossible to turn away. It's just impossible. But how long will that last? And will the government now finally, and federally and provincially, all provinces, will they finally do something to make a true difference?
Well, I think that's something we'll have to wait and see. Hopefully we do see some changes. Cyn, thank you very much for joining us this morning. Always incredible to talk to you. And
yeah, it's been a while,
Raj. We haven't seen each other in a long, long time. And we haven't seen anybody in a long, long time. Thanks very much, Cyn.
Okay, take care.
We'll have more on Breakfast Television coming up after the break.